Go.
Hi.
Hello, hi. My
Hi.
name is Bonita. Your name?
I'm Catherine.
Okay.
Catherine Woodard.
That's nice to meet
Good
you.
to meet you.
Good,
Good
good,
to
good,
meet you.
good, good. Hey, before we get started, I want to let you know with our company that by law that if you let me know that if of any abuse or neglect towards a child, yourself, or anyone in particular, then I do have to report that to the law
Mhm.
or possibly Child Protective Services. So
Mhm.
I normally let my clients know that up front.
Okay.
So just in case, just for their safety and for their loved one's safety or for a child's safety. So do
Okay.
you have any questions?
No questions at all.
Do you have any questions about the informed consent forms you signed while you were waiting to see me today?
No.
Okay.
I fully
Oh,
understand it.
oh,
Thank you.
okay.
Mhm.
Okay. Okay. So, uh, Miss Kathy, um, tell me now why did you come to see me today?
I came to see you today because I have um, some um, issues
Mm-hmm.
regarding the fact that I have recently been displaced.
Mm-hmm.
As an employee, my
Mm-hmm.
company has been struggling and I have been downsized.
Oh, wow.
Um,
Okay.
my position was eliminated.
Okay.
Okay. And there are several issues that I'm dealing with at this point in my life.
Okay.
The first issue being the one of finding employment at my particular age. I'm over 60,
Mm-hmm.
so know that I am going to face barriers in terms of ageism because I am a baby boomer. Also, as you know, I'm a black female, so
Mm-hmm.
facing or troubled about issues dealing with the fact of not only racism but sexism also.
Mm.
So the three issues that I am dealing with is ageism, racism, and sexism in
Okay.
terms of employment.
Okay. There's a lot of
Okay,
isms to be
a
dealing
lot of
with.
isms to be dealing with.
And I can clearly
Okay,
understand your
okay,
concerns
okay.
in regards to racism, sexism, and ageism. I
Hmm.
mean, those are just a reality of life.
Yes, yes, yes,
Okay.
they are.
Well, can you tell me, are you currently working?
No, as I said, about 2 weeks ago,
Okay.
about 2 weeks ago, um, my company advised me that my position had been eliminated. I saw um, uh, the potential for being downsized because the company has been floundering and they had already let go about 6 people.
Okay.
And so, although um, it's a reality for many organizations. For me, it's something that has become a mental health issue,
Okay.
um, and I don't want to. I'm trying to prevent depression
Mm-hmm.
um, um, and uh, feelings of uh, lacking self worth.
Mm-hmm.
Also, fear. Okay, so those are some of the issues I'm dealing with.
Okay. Okay.
Okay.
Okay. How long did you work at your particular position?
At this particular position, I worked nearly 2 years,
Okay.
but in the field, I've worked for more than 40 years in the field.
Wow.
Right.
Wow. Wow. That's
Hmm.
very impressive. So
Hmm.
you're definitely used to working and being productive and being
Right.
viable
Right.
and and just in other words, just enjoying life.
Right. Right.
And
Right.
okay.
Right.
Okay. Okay.
Okay.
Tell me, how did it feel when your employer informed you that you were being let go?
Um, uh, of course, um, you feel you were concerned
Mm-hmm.
because you no longer have income,
Okay.
you no longer have insurance. Uh, of course, you've bonded with some of the um, other individuals who work in the company. So, of course, there's um, um, you know, the severing of relationships. Um, but the most issue I have concern with, of course, is living. Because the income stream stops.
Okay. Okay.
So that's my primary concern is how am I going to survive?
Are you going to?
Hmm.
Okay. Okay. Um, have you? Do you know? Are you going to be receiving workers' comp or a severance pay from your position?
They did offer 2 weeks severance,
Okay.
and they did offer prorated vacation. I had 2 weeks vacation, so they're going to prorate that vacation. But that is the extent of the severance.
Okay.
Okay.
Wow. Wow. So you definitely have a lot going on, a lot of
Yes.
concerns
Yes.
because
Yes.
of, just for 1 month,
Right.
just being able to cover expenses and just living expenses,
Absolutely.
that has to
Absolutely.
be
Um,
a lot of fear.
right.
You know.
Because your basic needs have to be met: food, shelter, and clothing. And so my primary concerns is how am I going to meet those basic needs?
Okay. 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 Um, have you thought about how you're going to meet those basic? How have you met those basic needs in the past?
In the past, I've always been able to work
Okay.
for gainful employment, and because gainful employment provided the ability to take care of those basic needs.
Okay.
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 So now I'm very much concerned that at this point in my life, let's face it, in today's society, um, the there is not a mainstream um, positions in terms of those individuals who are over 55 and over.
Okay.
Okay.
And that is a reality.
The graying of America is a reality, but and there's a lot of baby boomers out there.
Yes.
Okay.
Yes. That's true.
And the job market has changed in the last 10 to 15 years.
Okay. 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 When for the job market to change, have you looked at possibly changing some of your skill sets?
That's a very, very that's a very good question. I have looked into and thought greatly about honing my skills, but also that means returning to the classroom or returning to school, which means more debt.
Okay.
Okay, because you have to pay for it.
Yes,
And how
you
are you
do.
going to pay for it? Well, if you and if you don't have a job, then you can't pay for it.
Correct.
So that's sort of a catch-22.
Correct.
You need to hone skills for today's job market, but at the same time, how do you do that?
Yes.
So that's a big concern.
That is a big
That's a big
that
concern.
is a big concern. Well, I want to go back a little bit. You
Okay.
say that you talk about when you now that you're not no longer working,
Mhm.
you're a displaced worker. There's a
Mhm.
lot of fear and possible depression.
Mhm.
Can you describe to me how fear and depression is looks in your eyes? What do
Okay.
you go through?
Okay. Well, of course, as I said, meeting those basic needs. So fear sets in is this, how am I going to make a mortgage payment?
Okay.
How am I going to pay utilities? How am I going to buy food? I no longer have insurance. Okay. So, um, you know, uh, how am I going to take care of my health needs? So all those um, are big stressors that cause fear. Fear of, how am I going to survive?
Okay. 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 How does that affect your emotions?
Um, of course, when you're in a situation where there's fear, um, you're down. You have, you're not, you know, you're down because you're trying to figure out how I'm going to survive. How am I going to make it through the maze of all the things that need to be taken care of in terms of living.
And going through the maze of life can be tricky. You know,
It can be very tricky. The one thing that I do know is I have faith,
okay,
and I
great.
have faith,
Okay.
and because of that faith and that belief in Christ Jesus, I know that um, um, I'm going to be okay.
Okay.
I'm going to be fine. I know that.
It sounds like you have a lot of support with your faith in God,
hmm
and and you know, what type of support do you have with, you know, with your faith in God?
well, I have that assurance um, that when one door closes, another door opens. So I have that. I have
Okay.
that. I have a strong belief system.
Mm-hmm.
Okay, I have a very strong belief system, but there's also the reality of life
Okay.
that you must deal with.
Mm-hmm.
hmm
And that
hmm
is true. To, you know,
hmm
dealing with the reality of life.
hmm
Um, you had talked about a little bit about depression.
hmm
Um, is that something you think with depression? Are you dealing with that now, or are you just thinking it may occur as time will progress?
Um, I'm not dealing with it now, but I know
Okay.
it's something that's a reality
Okay.
because you, um, a person, when they're um, when something is taken away, okay, that leaves a vacancy,
Mm-hmm.
and to fill that spot, how do you fill that spot? Um, um, Losing, whenever you lose something, there is a void. Okay. And so that void leaves you doubtful. It
Mm-hmm.
leaves you doubtful about your abilities. It leaves you doubtful about um, your your skills. It leaves you doubtful about, as I said, you're wondering, okay, how how am I going to survive? So, you know, and as a as a single individual,
Mm-hmm.
okay, without a support system, I depend on me. There's no one else to fall back on.
Okay.
Okay.
So you don't have anyone to particularly to fall back on at all.
No, no,
Okay.
no, no, no. So being a single individual, that is a stressor, in terms of, okay, how am I going to survive?
How, you know, can you give me examples of times in your life where it was a stressor, but you learned to survive?
Oh, yes. This is the third layoff
Okay.
that I've gone through, and um, each time, um, when um, the first time that I went through the downsizing or re-engineering
Mm-hmm.
of my company, um, it was a shocker.
Okay.
It was a shocker because
Mm-hmm.
it was, even though I knew again that the company was floundering, it was a shocker in that I didn't know that the company was going to close. We
Okay.
knew that we were struggling, but had no idea that it was going into bankruptcy. So it was
Oh wow.
a huge shock.
Oh
And the
wow.
first time that I had been laid off, so
Mm-hmm.
um, I have some resiliency
Mm-hmm.
because, and then the second um, um, time that the job was eliminated, it was a grant funded program, and we were awarded the grant, and then the grant was pulled out, was pulled away. So there I was again, in the same situation, in that, downsized again.
Okay.
But again, I was able to survive.
Mm-hmm.
But over the past 6 years, it's been a process over the past 6 years.
Mm-hmm.
So, you know, um, uh, society has changed um, greatly over the past 6 years. There have
Mm-hmm.
been more companies that have closed. There have been, um, uh, of course, now there are new, every year there are new, more um, trained individuals coming into the workforce.
Mm-hmm.
Young people that are graduating from college,
Mm-hmm.
they're graduating with masters and PhDs, and they're coming into the workforce. so the baby boomers who should actually be leaving the workforce because of today's society, you have to remain in the workforce, so it's very difficult to find your niche,
To find your niche.
to be considered a valuable contributor to society.
Oh, okay. Okay. Well, it sounds like to me you've always been a survivor. You're resilient.
Yes.
You keep moving forward.
Yes.
You know, it's upsetting when jobs change, and here you are. You want to be vibrant and active and employed, and
Absolutely.
independent
Yes,
to be able to play.
absolutely,
And,
absolutely.
but you have to now worry about, well, every few months I'm going to have a job. I'm going to be able to pay my bills.
Right, right.
And what do I need to do?
Right.
And
you certainly grasp it. Yes. Yes, you certainly grasp it.
and that's important to you. That's a value. That's employment is a value for you. That's not always for everyone, but that for you, that's very, very, very important.
Yes.
And so, the goal is to figure out, well, what do what is this young Kathy wants to do in her current life? What is the next step?
What's the next step? Now that's the key to figure out what's the next step.
Have you thought about what's the next step?
I have given it some thought. Okay. I've given it some thought. I just haven't really formulated a plan yet.
Okay.
I'm still in the stage of thinking, okay, what is the next step? I haven't formulated a plan yet.
Okay. Since you're forming a thought, you're trying to figure out your next step. But right here in this present, what are you thinking about doing right now?
Right now, I'm actually thinking about returning to school.
Oh,
I'm
wonderful.
actually thinking about returning to school and to try to create some value.
Oh, okay.
And by creating value, be more marketable, having a more marketable skill. So I'm seriously thinking about that, but also evaluating, okay, what does this look like in terms of debt?
Okay.
What does this look like, and will the debt that I incur, can I offset it? Will it pay off?
Well, it sounds like you've taken a lot of thought to what you want to do, but at the same time, you don't want to have such a debt that it's difficult to pay off.
Right. I want to enjoy life.
Yes.
I want to be debt rich.
Oh, me too. It's important.
Yeah.
That is just not a friend.
No, that is not a friend, and it's especially not a friend when you don't have a job and you gotta survive. She don't need to add to.
Yes. Oh gosh.
Yes.
But it sounds like to me that you want to continue to move forward.
Absolutely.
And that you're not quite ready to retire.
Absolutely not.
And that you still have a lot that you want to do in the employment world.
Right.
And the factors are that, because of ageism, being a baby boomer, race, being female, that those are barriers that can limit your job opportunities. However, you've mentioned that your faith has gotten you through a lot of those barriers, and that opportunities, and that your faith will continue to get you through those barriers.
Absolutely.
Because you sound like a woman who's very resilient, and that and you're determined to move forth regardless of what society says, and how regardless of the situation. So, but the key is to make sure that as you said, you want to have a plan, and that you continue to move forward. So, is there anything else you want to share with me?
No, I think that this discussion has really been beneficial
Mhm.
because sometimes when you share with someone
Mhm.
and then you share with a professional, they can kind of guide you in
Mhm.
a better direction or let you know you are uh, making progress.
Yeah. Yeah. And for me, I want to share with you that I really can relate to what you're going through. A little, for me, a few years ago, I decided to return to school to get my master's in social work, and I was concerned because I was changing job careers from the military to become a social worker. Also to returning back to school and being older and then being in the classroom with 20 something year olds or 30 something years old, and it's like, oh, will I be able to handle this load? And sometimes we just have to just make that decision. Just I had to make the decision just to go for it, even though it was scary, even though I was tired, even though I felt like all the isms that you dealt with. But I had to make the decision that I was going to go forth, even despite how I felt, despite my situation, and it has been beneficial. And 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 so I just want to encourage you. You're not alone.
Okay. All right.
You're not alone.
It's very enlightening.
Yeah.
Yeah. I'm as I read articles and do research. Um, yeah. This is a ever changing world, ever changing world.
So you said you read articles, and have you ever thought about perhaps teaching or become a proofreader or just uh, uh, private teaching?
Yes, I have. Um, I am an instructor
Oh, okay.
at Indiana Wesleyan University. So
Okay.
I am an instructor at Indiana Wesleyan and adjunct. So
Oh,
I have
wow.
given some thought to, as I said, to going back to school, giving some thought to maybe working on a PhD, giving some thought to maybe working on a teaching certificate, going back into the classroom, looked at some opportunities in terms of opening a tutoring center. So there's a lot floating around out there. I just haven't, as I said, I've been thinking, but I haven't formulated a plan yet. Just
Okay.
thinking.
Okay. But right now, you're just focused on the here and now and
Right.
trying to take care of your basic needs.
Right. Absolutely.
And trying to formulate a plan for that at this point in
Yes.
time. And just learning to take care of
Yes.
you.
Yes.
And that's
Yes.
good. That's
Yes.
good. Miss
Yes.
Kathy, that is good.
Yes.
It's, it, from what I've observed, you still want to go for it.
Most definitely.
And
Most definitely. Got a whole lot more living to do.
and you sound like you got a whole lot more living to do. And so, and it sounds like that, instead of looking at yourself as a displaced worker, you're going to eventually be a place worker.
That's my plan. That's the plan. That is the plan. That's the plan. Yes. Yes.
Well, our time has ended.
Okay. Well, thank you so much.
And if you feel the need to come back, you're more than welcome to come back. And we can just sit and talk. Sometimes, like you said, sometimes coming to a counselor doesn't necessarily mean you want the counselor to solve your problem. But sometimes you just want somebody to listen to you.
Absolutely.
And knowing that we won't break confidentiality unless if you find that you're trying to harm yourself.
Right.
And I'm biased, opinion, no judgment, and just somebody who can relate to what you're going through.
Right. And, well, I feel better already. I feel this has been a very beneficial session, and thank you so much for taking the time to listen and to have an open mind, as you said, not be judgmental. So that is That's very freeing. It's
Mhm.
very freeing.
Okay.
Hmm.
All right.
Well,
Thank you
thank you so
very
much
much.
again.
Yeah.
All
All
right, all right.
right.